If you're constantly clearing your throat, waking up with that sticky feeling in the back of your mouth, or wondering why there always seems to be mucus sitting there no matter how much water you drink, I want to tell you something that may surprise you. In many older adults, the real problem is not that your body is making far too much mucus. The real problem is that mucus is no longer moving, draining, or clearing the way it used to, and that small difference changes everything. I've had many patients look at me with genuine worry and say, "Dr. Reynolds, is something seriously wrong with my lungs?" Others fear infection, some fear cancer, some are simply exhausted by the constant swallowing, coughing, hawking, and throat clearing that never seems to stop. And I understand that, because when something is always sitting in your throat, it does more than irritate you. It steals comfort, it disrupts sleep, it affects your voice, it makes eating less enjoyable, it can make you feel older, more fragile, and less in control of your own body. I'm Dr. Thomas Reynolds, and in this video I'm going to walk you through the real reasons mucus seems to stay in your throat, especially after 60, 70, and beyond. We're going to count down the most common hidden causes, what most people get wrong, what changes with age, and what you can actually do to calm the cycle. And stay with me, because the number one cause is the one many people never suspect. It's also the reason so many treatments fail. And if this is something you deal with often, tell me in the comments where you're watching from and whether your mucus is worse in the morning, after meals, at night, or all day long. Those patterns matter more than most people realize. Let's begin with number 7. Number 7, dry air and dehydration can make mucus thicker, stickier, and harder to clear. A lot of people think mucus means wetness, too much moisture, too much fluid. But in reality, one of the most common reasons mucus becomes so annoying is the exact opposite. It becomes too thick. Think of healthy mucus like a thin protective gel. It lines the nose, throat, and airways and helps trap dust, pollen, and germs. That is normal. That is protective. But when you are dehydrated or when the air around you is dry, that gel becomes more like paste. It stops flowing smoothly, it clings, and after 70, this becomes more common. Many older adults drink less because they are trying to avoid nighttime trips to the bathroom. Some take medications that dry the mouth or reduce secretions. Some sleep in heated rooms during winter or use fans that dry the throat overnight. The result is a throat that feels coated, especially first thing in the morning. That does not mean you need to force gallons of water, but it may help to sip fluid steadily throughout the day instead of drinking very little and then trying to catch up at night. Warm fluids can be especially soothing. Some people notice benefit from using a humidifier in the bedroom, particularly during colder months. And if you breathe through your mouth while sleeping, the dryness can become even worse by morning. So if your mucus feels sticky rather than runny, do not automatically assume infection. Sometimes the issue is not overproduction. It is poor texture and poor clearance. Now that may sound simple, but the next cause is one of the biggest reasons people keep treating the wrong area. Number 6, the mucus may not be coming from your throat at all. It may be draining from your nose and sinuses. This is what many people know as postnasal drip. The name sounds harmless, but the sensation can be miserable. You feel something dripping, coating, or collecting in the back of the throat. You swallow repeatedly. You clear your throat all day. You may even feel like something is stuck there. Here is the misunderstanding. People often think postnasal drip means a dramatic runny nose. Not always. In many older adults, the nose may feel only mildly congested or not congested at all, but the drainage still slides quietly down the back of the throat, especially when lying down. Why does this happen more with age? The nasal passages change. The lining becomes more sensitive. Allergies may still play a role even later in life. Indoor irritants like dust, mold, fragrance sprays, and smoke can keep the tissues inflamed. And sometimes long-standing sinus inflammation never becomes severe enough to feel like a full sinus infection, but it is enough to keep the drip going. Picture your nose and sinuses as an upstairs room with a slow leak. You may not see a flood on the floor, but the water keeps finding its way down the wall. That is what drainage into the throat can feel like. So what can help? Saline nasal rinses or saline sprays may help thin and flush irritants when used gently and consistently, not harshly, not obsessively, just regularly. Some people benefit from reducing bedroom dust, washing pillowcases more often, and paying attention to whether symptoms worsen around pets, cleaning products, or seasonal pollen. If allergies are suspected, discussing targeted treatment with a physician may help support calmer nasal tissues. And here's the important point. If the source is above the throat, throat lozenges alone may never solve it. You have to calm the drainage upstream, but we're not finished because the next cause fools even very attentive people. Number 5, silent reflux may be irritating your throat, even if you do not feel classic heartburn. This is one of the biggest hidden causes of chronic throat mucus, and it surprises people because they tell me, "Doctor, I don't have acid reflux. I never feel burning in my chest." That may be true, but reflux does not always show up as classic heartburn. Sometimes stomach contents travel upward just enough to irritate the throat, voice box, or upper airway. This is often called laryngopharyngeal reflux, but in plain English it means reflux that reaches the throat. And the throat is delicate, much more delicate than the stomach. When that tissue gets irritated, the body responds protectively. It may create more mucus, it may trigger throat clearing, it may cause a lump in the throat feeling, hoarseness, chronic cough, or symptoms that are worse after meals or when lying down. Think of it like a small splash of something irritating landing on a sensitive surface over and over again. Even if it is not enough to cause a fire in the chest, it can still keep the throat inflamed. This becomes more common with age for several reasons. Muscle tone changes, digestion may slow, some people eat later in the evening, some take medications that can affect the valve between the stomach and esophagus. Weight changes and abdominal pressure can also play a role. A few simple habits may help reduce this pattern in many older adults. Avoid lying down too soon after dinner. Consider smaller evening meals. Limit heavy late-night snacking. And notice whether caffeine, alcohol, tomato-heavy meals, chocolate, peppermint, or fried foods make symptoms worse. Elevating the head of the bed slightly may help some people, especially if morning throat mucus is a major issue. And if your voice is frequently hoarse, your throat feels raw, or the mucus always seems worse after eating or overnight, keep silent reflux high on the list. Now the next cause is less dramatic, but incredibly common. Number 4, your medications may be drying, thickening, or irritating your throat. This is one of the reasons I always tell older adults not to judge symptoms in isolation. The body is a system, and once you're taking several medications, even very helpful ones, they can interact with your comfort in unexpected ways. Some medications may dry the mouth and throat, others may contribute to reflux, some inhalers can irritate the throat if the mouth is not rinsed afterward. Certain blood pressure medications, especially those associated with chronic cough, may make you clear your throat more often. Some antihistamines can reduce watery drainage but leave mucus thicker and stickier. Even supplements or over-the-counter remedies can matter. Now, I'm not telling you to stop anything on your own. Please don't do that. But I am telling you this. If your throat mucus became noticeably worse after starting a medication, changing a dose, or adding an inhaler, that timing matters. A good medication review with your doctor or pharmacist can sometimes uncover a trigger people have been suffering with for months, and suffering unnecessarily. If you use an inhaler, especially a steroid inhaler, rinse your mouth and gargle afterward if your doctor has advised that. If dry mouth is part of the problem, sugar-free lozenges, saliva-supporting strategies, and better hydration timing may help. The goal is not to guess. The goal is to notice the pattern. And that leads us to a cause many people feel at night without realizing it. Number 3, mouth breathing, snoring, and poor nighttime airway habits may be setting you up for morning mucus. If you wake up with the worst symptoms of the day, pay close attention here. When you breathe through your mouth at night, the throat dries out. When the throat dries out, mucus thickens. When mucus thickens, it sits there. Then you wake up coughing, swallowing, clearing, and wondering what happened. Snoring can worsen this. So can nasal congestion. So can sleeping flat on your back if reflux is also involved. In some people, sleep apnea may play a role, not because it directly creates mucus, but because it changes breathing patterns, dryness, airway irritation, and nighttime pressure. Morning throat symptoms are often a clue. If the mucus feels worse right after waking and improves somewhat as the day goes on, nighttime conditions may be feeding the cycle. A few practical steps may help. Improve nasal airflow if congestion is present. Keep the room from becoming too dry. Avoid large meals and alcohol close to bedtime, and pay attention to whether you snore heavily or wake up with a dry mouth every day. If a partner has noticed pauses in breathing, gasping, or very loud snoring, that is worth discussing with a physician. Not just for mucus, but for heart health, brain health, and energy as well, because good sleep is never just about sleep. In older adults, it touches memory, mood, blood pressure, balance, and independence. And now we come to something even more personal. Number 2, your throat may be stuck in an irritation cycle, and constant throat clearing may be making it worse. I know this can be hard to hear because throat clearing feels like relief. For a moment, it feels like you're getting something out. Sometimes you are, but often repeated hard clearing slams the vocal cords and irritates the tissues more. Then the throat feels even more sensitive. Then the body wants to protect that irritated tissue with more mucus. Then you clear again, and around it goes. It becomes a loop, not because you are doing something wrong on purpose, but because the throat has become reactive. Imagine rubbing a patch of skin over and over. Even if you started because it itched, the rubbing itself soon becomes part of the problem. The same can happen inside the throat. A gentler strategy may help break that cycle. Instead of forceful throat clearing every time you feel mucus, try a small sip of water, a gentle swallow, or a quiet cough if needed. Warm tea, steam, and good hydration may help soothe tissues. Some people also benefit from simply recognizing the urge before reacting to it. That alone can reduce the frequency. And if you are speaking for long periods, talking loudly over the television, or straining the voice frequently, the throat may never fully calm down. Protecting the voice is part of protecting the throat. If this video is helping you see the problem more clearly, take a moment to like and subscribe. I want this channel to be a place where older adults get real explanations, not vague reassurance and not unnecessary fear. Now let's get to the number 1 reason, the one that ties everything together. Number 1, the real cause is often not too much mucus. It is an aging clearance system that has become slower, drier, and more easily irritated. This is the truth almost no one explains properly. Your nose, sinuses, throat, saliva, swallowing muscles, stomach, and upper airway all work together like a cleaning crew. Mucus is produced. Tiny hair-like structures help move it. Saliva helps wash things down. Swallowing helps clear the throat. The tissues stay moist. The pathways stay calm. In a younger body, that system often runs quietly in the background. But with age, several parts may become less efficient at the same time. Saliva production may decline. Tissues may dry more easily. Swallowing may become a little less coordinated. The tiny clearing motions in the airways may slow down. Reflux may become more common. Nasal irritation may linger longer. And the throat becomes more sensitive to small changes. So the sensation of always having mucus is often the result of a slower housekeeping system. Not necessarily a dangerous flood, more like a cleanup crew that's understaffed, underwatered, and constantly being interrupted. That is why one single remedy so often fails. If you only attack mucus as if it were the enemy, you miss the system around it. The real fix is to support clearance. That means thinning thick secretions, calming nasal inflammation, reducing silent reflux if it is present, protecting the throat from repeated trauma, improving hydration, addressing mouth breathing, and reviewing medications when needed. It means treating the source, not just reacting to the sensation. So let me give you a simple daily approach many older adults may find helpful. Start with hydration early in the day, not just coffee. Add water or warm herbal tea. Use gentle saline support for the nose if drainage seems to be part of the problem. Pay attention to meals. If symptoms worsen after eating or at night, reflux may be involved. Avoid lying down immediately after dinner. Keep the sleeping environment from becoming too dry. Try to replace hard throat clearing with a sip, swallow, or gentler cough when possible. Review medications and inhalers with your doctor if symptoms have persisted. And most importantly, watch for red flags. If you have blood in the mucus, unexplained weight loss, fever that does not improve, worsening shortness of breath, persistent hoarseness, pain with swallowing, frequent choking, a smoking history with ongoing throat symptoms, or the feeling that food is truly getting stuck, please do not self-diagnose endlessly. Get evaluated calmly but promptly, because common does not mean harmless in every case. Still, I also want to reassure you, in many older adults, chronic throat mucus is not a sign of something catastrophic. It is a sign that one or more parts of the upper airway system need attention, and that is a very different message. It means there may be something you can improve. It may take observation. It may take consistency. It may take a few small changes rather than one dramatic one, but small, steady changes matter. They matter for comfort. They matter for sleep. They matter for energy. They matter for confidence when speaking, eating, resting, and simply getting through the day without that constant irritation in the background. So if you've been feeling frustrated, embarrassed, or even frightened by this, please remember your body may not be failing. It may be signaling. It may be asking for better support, better moisture, better drainage, better timing, and a better understanding of what is really going on. That is a hopeful message, because once you understand the pattern, you are no longer just guessing. You can start making smarter choices. You can start noticing triggers. You can work with your doctor more effectively, and you can begin to feel more in control again. Thank you for spending this time with me. If this sounds like your experience, leave a comment and tell me when your throat mucus is worst: morning, after meals, overnight, or all day long. And if you want more clear, compassionate guidance on aging well, protecting your energy, improving sleep, supporting your heart, your memory, your balance, and your independence, subscribe and join me again. I'm Dr. Thomas Reynolds, and I'll see you in the next video.